तो हम दोबारा से अपना कंटिन्यू करते हैं सेम टॉपिक ही। इनिशियली हमने टॉपिक के बारे में स्टार्ट किया था और बच्चों की तस्वीरें देखी थी जिसमें दे आर हैविंग सीवियर डिजीज एंड नाउ दे आर अंडर रिहेबिलिटेशन। So we continue with our topic. So next is what we need to know after this lecture. इस लेक्चर के बाद आपको क्या कुछ पता होना चाहिए उसके बारे में हम देखते हैं। लर्निंग ऑब्जेक्टिव्स। लर्निंग ऑब्जेक्टिव हमारे पास हमें प्रिवेंशन के बारे में पता होना चाहिए और उसके एग्जांपल्स पता होने चाहिए। सेकेंडली वी मस्ट नो व्हाट इज मेंट बाय हेल्थ प्रमोशन एंड व्हाट इज मेंट बाय हेल्थ एजुकेशन। तो हेल्थ प्रमोशन में और हेल्थ एजुकेशन में क्या डिफरेंस है और डिफरेंट लेवल्स ऑफ प्रिवेंशन कौन से हैं और उनके एग्जांपल्स हमें पता होना चाहिए। हमारा ऑब्जेक्टिव है एट द एंड ऑफ दिस लेक्चर। नेक्स्ट हम चलते हैं अगली स्लाइड पे। लेवल ऑफ प्रिवेंशन। लेवल ऑफ प्रिवेंशन जो है हमारे पास 4 लेवल्स ऑफ प्रिवेंशन है। प्राइमोडियल प्रिवेंशन, प्राइमरी प्रिवेंशन एंड secondary prevention, and lastly tertiary prevention. Level of preventions are primordial prevention, then primary prevention, secondary prevention and tertiary prevention. Now there is a term intervention. What is meant by the intervention? Intervention basically putting in a break or putting in a stop. It is an attempt to intervene or interrupt the usual sequence in the development in the disease in any individual. An attempt to intervene or interrupt usual sequence of development of disease in a man. Basically जो events of disease हैं, जो events हैं disease के, initially there is a entry of the pathogen into the human body, then it will stay there and will not be having sign symptoms. Then the individual will have the sign symptoms. Then either he recovers or having more complications requiring treatment, and then eventually either he will fully recover or partially recover, developing more complications, can result in death or can result in permanent or temporary disability. So any attempt or any effort to put an end to the sequence of disease development in any individual is intervention. Then intervention has various aspects: prevention of treatment, prevention of health education, prevention of social and moral and economic support. नेक्स्ट जो आपके सामने डायग्राम नजर आ रही है ये आप लोग बहुत दफा देख चुके हैं, पहले भी हम इसको डिस्कस कर चुके हैं. दैट इज एपिडेमियोलॉजिकल ट्राइड. एपिडेमियोलॉजिकल ट्राइड consists of 3 components: agent, environment and host. Epidemiological triad के 3 ही components हैं: agent, environment and host. All of them are required for development of any disease, and all these having different factors which favor the development of the disease. For example, if the agent is virulent means having more ability to cause disease. Small number of organisms can cause disease. Then environment, suitable environment is required for the agent to cause the disease. If the environment is not suitable, that organism will not be able to cause the disease. Thirdly, host. If the host defense mechanism is strong, he will be protected from the disease. or even if he gets the disease, he will have the spontaneous recovery or rapid recovery. And if the defenses of the host are weak, then there will be more chances of getting the disease and more chances of developing severe disease. तो इन तीनों का आपस में लिंक है. दिस इज एपिडेमियोलॉजिकल ट्रेड. बार बार आपके एग्जाम में पूछा जाएगा. आपकी जो पब्लिक हेल्थ कंसल्टेंट की जो लाइफ है उसमें भी ये बार बार चीजें डिस्कस होती हैं. नेक्स्ट वन इज द मोड्स ऑफ इंटरवेंशन. इससे पहले हम लोगों ने पढ़ा था लेवल ऑफ प्रिवेंशन. लेवल ऑफ प्रिवेंशन में प्राइमोडियल प्रिवेंशन, प्राइमरी प्रिवेंशन, सेकेंडरी प्रिवेंशन एंड टर्शियरी प्रिवेंशन, 4 लेवल्स हमने पढ़े थे. मोड्स ऑफ इंटरवेंशंस में 5 में इंटरवेंशंस हैं. फर्स्ट वन इज हेल्थ प्रमोशन, second one is specific protection, third one is early diagnosis and prompt treatment, fourth one is disability limitation, and fifth one is rehabilitation. Health promotion and specific protection come under the heading of primary prevention. Early diagnosis and prompt treatment comes under the heading of secondary prevention. And disability limitation comes under the heading of tertiary prevention. Rehabilitation is also under the heading of tertiary prevention. Then हमने initially learning objective में एक term पढ़ी थी health promotion. What is meant by health promotion? The process of enabling individuals to increase control over and to improve their health. बेसिकली आसान जुबान में इस तरह से है कि हेल्थ प्रमोशन ऐसा प्रोसेस है जिसमें जो इंडिविजुअल्स हैं वो अपनी हेल्थ के खुद इन कंट्रोल हों, अपने हेल्थ के खुद रिस्पॉन्सिबल भी हों और उनके पास नॉलेज, सफिशिएंट नॉलेज हो ताकि अपने अच्छा से अपना ख्याल रख सकें, अपनी सेहत का ख्याल रख सकें. द प्रोसेस ऑफ एनेबलिंग टू इंक्रीज कंट्रोल ओवर एंड टू इम्प्रूव द हेल्थ. किसी भी इंडिविजुअल को एम्पावर करना, उसको ज़्यादा मेडिकल नॉलेज देना ताकि वो प्रिवेंटिव एस्पेक्ट को फॉलो कर सके, प्रिवेंशन ले सके और अपनी हेल्थ को बेहतर बना सके, डिजीज से बचाव मुमकिन हो उसके लिए. और हेल्थ प्रमोशन इज अ जर्नल एफर्ट. जर्नल एफर्ट मीन इट इज नॉट स्पेसिफिक अगेंस्ट अ स्पेसिफिक डिजीज. ये नहीं है फॉर एग्जांपल कि मलेरिया से बचने पे इसका फोकस है कि मलेरिया ना हो. इट्स अ जर्नल education of the patient to improve their health. For example, telling the patient to have clean drinking water. If he will have the clean drinking water, a number of different diseases can be prevented. It is not directed against a single disease. A number of diseases caused by microorganisms will be prevented. A number of diseases caused by the pollution of the water by heavy metals will also be prevented. Secondly, for example, if we tell the patient to drain off the stagnant water, if we tell the patient to drain off the stagnant water, a lot of diseases which are caused by mosquitoes will be prevented in this way. So these are the health promotion measures, are the journal efforts, journal steps against various diseases, not specific to a single disease. Then next जो हमारा एक और टर्म थी, that is health education. Health education and health promotion, they are the overlapping terms. Health education basically is educating the people about preventive steps या precautionary measures के बारे में लोगों को educate कर देते हैं. This is the cost effective method. Instead of spending so much money on the treatment and diagnostic test and laying off from proper work resulting in the stoppage of the earning, so it's better to take the preventive steps, so it is very cost effective. Then we have within this health education and health promotion, there are certain general steps which can be taken. For example, जैसे पहले आपको बता चुका हूँ, prevent of safe water supply, sanitary latrine installation so that sewerage water don't get mixed with the drinking water. Insect and rodent control. आप सबको पता है, all of you know that there are number of diseases which are caused by insects and rodents. For example, plague is caused by rodents, by rats. As said directly, it's not caused, but they are the vector for transmission of the disease. Then improved housing. A number of diseases caused by the congested, overcrowded housing. For example, TB. Next intervention is the nutritional intervention. आप सबको पता है, all of you know that balanced diet is very important to have healthy life. Excessive dietary intake will cause a number of different diseases, for example, obesity, hypertension, diabetes, and less intake of diet below the normal requirement will cause malnutrition, such as iron deficiency, anemia, and a number of other diseases such as rickets, osteomalacia. So nutrient balance is very important. Balanced diet is required. और इसमें अगर ओवर एक्सेस भी होगी तो भी हार्मफुल है, लेस इनटेक होगा वो भी हार्मफुल है, तो वी हैव टू कीप अ बैलेंस. सेकेंडली, जो बच्चे हैं, it is recommended that up to 6 months of age, all babies should have breastfeed, exclusive breastfeed up till 4 to 6 months. And then along with the breastfeed, start the weaning foods. Weaning foods means starting the solid diet along with the breast milk and continuation of the breast milk until 2 years of age. That's very important. To protect the children from different infections. आप सबको पता है कि breast milk is having a number of antibiotics which protect the baby from number of different diseases. Then next one is the lifestyle changes and behavioral changes. Last time हम लोग जब क्लास में पढ़ा था, there are factors, host factors which are modifiable and there are factors which are non-modifiable. Modifiable risk factors which can contribute to the causation of disease are sleeping habits, smoking, drug abuse. They are modifiable. A person can stop smoking, can avoid drug abuse, can have proper sleeping habits. And non-modifiable factors are gender. A person usually can't change his gender. Age is always go on increasing. You can't slow it down or stop your age, or can't go back to young life. They are non-modifiable factors. So all these factors affect the disease causation and affect the general health of any individual. Then there is genetic counseling. For example, in Pakistan, we are having a large number of thalassemia patients. There are families which are continuously having thalassemia in every newborn baby they are having. So it is important to have their genetic counseling to avoid this disease, to avoid the transmission of this disease within the families. Marriage counseling is very important so that disease carriers don't marry each other, otherwise their children will be having 100% chances of getting the disease. Then periodic medical examination. Yearly basis पे अगर medical examination होता है, blood pressure, diabetes, ECG, ये अदर चीजें होती रहें तो it is helpful in early detection of the disease. Then एक और हमारे पास नेक्स्ट स्टेप है इंटरवेंशन का. पहले हमने हेल्थ प्रमोशन और हेल्थ एजुकेशन हमने सब पढ़ा. नेक्स्ट इंपॉर्टेंट स्टेप इज द स्पेसिफिक प्रोटेक्शन. Specific protection is oriented against particular disease. इसमें फिर further different steps हैं. For example, immunization. Immunization means vaccination against different diseases. For example, TB की vaccination है. BCG is the vaccination for TB. And then we have the vaccination for polio. Number of different diseases की vaccination available है free of cost. लेकिन फिर भी लोग vaccination avoid करते हैं. It is very unfortunate कि इतनी महंगी vaccinations लोगों को freely available है and लोग फिर भी vaccination करवाने को तैयार नहीं है. Then use of specific nutrients. Use of specific nutrients means, for example, iron deficiency is very common. So government took an initiative to add iron in the wheat flour to improve the iron intake of all the individuals. So they should not have the iron deficiency anymore. But it doesn't go on well with the general public. A lot of confusion was developed and propaganda was created against this fortification of wheat with iron. So eventually the government withdrawn this step of adding iron to the wheat flour. Then another step which was taken by the government, that was adding iodine to the salt. Iodine deficiency is also very common in hilly areas of Pakistan, causing vital and number of different health disorders. The government took the step of adding iodine in the salt, but it also doesn't go on well with the general public, and a lot of confusion was created against that. And generally, people avoid the purchase of iodized salt. Then another term is chemophilaxis. Chemophilaxis is taking the treatment before going to an endemic area. Example, Pakistan is endemic area for malaria. On the other hand, European countries and America are not having malaria cases, are not endemic for malaria. So if a European is coming to Pakistan or American is coming to Pakistan, he should start taking medicine before his departure from America or European from Europe. This is the chemophilaxis, taking the treatment before the causation of disease in order to prevent the causation of the disease. This is chemophilaxis, taking the medicine in advance. Then protection against occupational hazards. Different आपको पता है factories में, mines में, certain diseases are very common. For example, pneumoconiosis is a disease commonly caused in the coal workers. Coal mines में जो लोग काम करते हैं उनमें disease होती है pneumoconiosis. So proper wearing mask, glasses, personal protective equipment अगर उनके पास होगा तो chances of the disease will be less. Secondly, अभी जिस तरह आजकल epidemic है कोरोना वायरस के, तो health care workers are at risk of getting the disease. So personal protective equipment must be provided to all the healthcare workers, so they can be protected against this occupational hazard. Okay, this coronavirus disease is occupational hazard for the healthcare workers. Then protection against the accidents. Accidents is a broad term. Usually आपके दिमाग में जो बात आएगी with the accident, that is the road traffic accidents. Yes, road traffic accidents are included under the heading of accident, but there are number of different types of accidents: domestic accidents, and then factory accidents, and then the road accidents. Domestic accidents में falls हो सकती है, fall स्टेयर से कोई बंदा गिर गया, फर्श पे स्लिप हो गया, domestic fire है, domestic smoke, all of them can cause domestic accidents. Road traffic accidents में आपको पता है कि lack of awareness with the traffic rules, non observance of traffic rules. Thirdly, not wearing the seat belts, not wearing the helmets can result in a number of different accidents. So अगर ये सारे precautions लेंगे तो accidents avoid किए जा सकते हैं. Then ऐसी specific protection का एक continuation है, protection from carcinogens. Carcinogens में protection against carcinogens. For example, cigarette smoking exposes the individual to a lot of carcinogens. So avoiding the smoking can protect you from different carcinogens. Then avoidance of allergen. यहाँ पे पिंड इस्लामाबाद में आपको पता है कि काफी लोगों में एलर्जी होती है, पोलन एलर्जी. So avoiding the allergen pollens, one can avoid the allergy by wearing mask, wearing gloves, wearing glasses, or moving out of the city for 2-3 months can help in the avoiding of the pollen allergy. Then better environmental conditions, controlling the noise pollution, controlling the air pollution, water pollution can also help in the better health. Then consumer products, different तरह के लोग बाहर से खाना खाते हैं, different रेस्टोरेंट से, अगर उनके प्रॉपर क्वालिटी कंट्रोल चेक होता रहे तो डिजीज कॉज होने के चांसेस कम होंगे बिकॉज ऑफ द गुड क्वालिटी ऑफ द फूड. अगर अवेलेबल होगा तो डिजीज होने के चांसेस कम है. इसी तरह से इम्प्योरिटीज बहुत ज़्यादा ऐड की जाती है, मिलावट बहुत ज़्यादा की जाती है, अडल्ट्रेशन इसको कहते हैं. उसका अगर अवॉइड किया जाए तो हेल्थ बेहतर होगी बिकॉज ऑफ अवेलेबिलिटी ऑफ गुड डाइट. Then next one is the early diagnosis and prompt treatment. अर्ली डायग्नोसिस एंड प्रॉम्प्ट ट्रीटमेंट की इम्पोर्टेंस इसलिए ज़्यादा है कि जितना जल्दी आप डायग्नोस करेंगे उतना बेहतर ट्रीटमेंट हो सकेगी. और अर्ली डायग्नोसिस में यह है कि फॉर एग्जांपल आपके पास एक पेशेंट आया फीवर के साथ, तो आप उसको डायग्नोस करना बड़ा इम्पोर्टेंट है बिकॉज फीवर कुड बी बिकॉज ऑफ वेरियस कॉजेस. फॉर एग्जांपल इट कुड बी कॉज्ड बाय द टीबी, because of the TB, could be from malaria, or it could be from any other infection, for example corona, maybe from gastrointestinal symptoms. So diagnosis is very important in order to establish a cause, and then cause specific treatment होगी तो वो बहुत बेहतर होती है. तो अर्ली डायग्नोसिस में डिफरेंट चीजें कर सकते हैं. स्क्रीनिंग जिस तरह आप हर इंडिविजुअल को स्क्रीन आउट कर लें, सारे पूरे पॉपुलेशन के फॉर एग्जांपल बीपी चेक कर लें. दिस इज स्क्रीनिंग फॉर हाइपरटेंशन. सब लोगों के शुगर चेक करना शुरू कर दें. दिस इज स्क्रीनिंग फॉर डायबिटीज. देन कॉन्टैक्ट ट्रेसिंग, जिस तरह आप कोरोना वायरस का आजकल गवर्नमेंट क्या कर रही है कि एक पेशेंट अगर आया और उसका अगर पॉजिटिव टेस्ट आता है कोरोना का, उसकी सारी फैमिली को ट्रेस करके उन सबके टेस्ट किया जाता है ताकि दिस इज द कॉन्टैक्ट ट्रेसिंग, ताकि पता चल जाए कि डिजीज ट्रांसमिशन तो नहीं हुई लोकल लेवल पे. देन इंडिविजुअल एग्जामिनेशन में ब्लड टेस्ट आप कर सकते हैं, चेस्ट एक्सरे कर सकते हैं, यूरिन आरएच करवा सकते हैं, डिफरेंट स्पेसिफिक टेस्ट अवेलेबल है. और प्रॉम्प्ट ट्रीटमेंट में डिजीज स्पेसिफिक वंस डायग्नोसिस कंफर्म यू कैन हैव द रैपिड disease specific treatment for that disorder. Then अब हम second last slide पे आ रहे थे, that is the disability limitation. Disability limitation में ये है कि once the disease is caused and either there was a delay in the diagnosis or delay in the treatment or any other cause resulting in the complications. So we try to limit these complications so that disability is not caused, or either if the disability is caused, it should be the temporary, so trying to improve the health of the individual. Then last में हमारे पास आ गया, that is the rehabilitation. Once the complications are developed, they can cause the disability either temporary or permanent, and then the overall goal is to help this individual to return back to his normal life. For example, if a person is handicapped, disabled by the road traffic accident, we can help him to return to his normal life by providing him wheelchair or by adjusting his job according to his present status of the health. For example, if a policeman who is having the job of standing and he gets the accident, we can provide him the computer job or placing him in the traffic headquarters, police headquarters, so that he can do the table work. So adjusting the job according to the person. ये हम एक और टर्म पढ़ेंगे, that is ergonomics. Adjusting the job to the worker, not adjusting the worker to the job. तो यहाँ तक हमारा ये टॉपिक कंप्लीट हो गया, लेवल ऑफ प्रिवेंशन और मोड्स ऑफ इंटरवेंशन, और जिसमें हमने डिफरेंट लेवल्स ऑफ प्रिवेंशन पढ़े, प्राइमरी लेवल ऑफ प्रिवेंशन, प्राइमरी लेवल ऑफ प्रिवेंशन, सेकेंडरी एंड टर्शियरी लेवल ऑफ प्रिवेंशन. मोड ऑफ इंटरवेंशन में हमने पढ़ा हेल्थ प्रमोशन, specific protection, early diagnosis and prompt treatment, disability limitation,